So if you have heard me present before, I'm very collaborative, and this is an issue that affects all parents, sometimes with some frustration and stress. Other times, we wake up and our kids do things on their own. But I'm very collaborative, and I love hearing everyone's strategies that work for their own child, because sometimes what works for one child will work for another, or at least partially. So if you're open to sharing your ideas and success stories at the end, I would love to hear them, because I believe the more tricks we have in our bag, the better. So let's just dive right in. All right, so I always love to talk about why we're talking about this. And as if you're a parent, you know why we're talking about it. It is a very important developmental skill, toilet training. It improves self-confidence for our young ones. It improves social acceptance, especially amongst their peer groups, especially as they get older. When all students are kind of going through the same developmental phase, it's one thing, but as our children can be a little bit older, when they have successfully toilet trained, it's even more, I think, important and influential with their peer group. Of course, we always want our kids to be as independent as possible, and this is definitely one area that it's very important. That way, they don't need as many adult helpers to be assisting with this skill. And I'd be remiss if I didn't talk about it also can potentially decrease abuse risk. We know the fewer adults who are in the bathroom with our children, probably the better for everyone concerned, just to appease us parents to know that our kids are doing this skill independently and don't have to have as many hands-on helpers. And even though it shouldn't, it can often increase the likelihood of inclusion. I love to say that this shouldn't be a factor when it comes to school and inclusion, but unfortunately, and I think Susan Tieford might agree, she's our school age director, we do see this issue come up when it comes to inclusive practices in the public school system and private schools as well. Often private preschools will have criteria for when children can move on to certain classrooms based on their toilet training readiness. And in the public school, something I like to bring up in IEP meetings is that this should not be a factor, because some students, maybe not ours, but potentially ours, some students may never acquire fully independent toilet training, and you cannot deny them access to the regular education classroom because of lack of that skill. However, it just in the real world, it can come up with, oh, we don't have a bathroom in the regular education, first grade, so they have to be in this classroom, or they have to be in this classroom that's closer to a bathroom. So in real world practices, this really does happen. Okay, let's talk about why it is more difficult for children with Down syndrome to acquire fully independent toilet training skills. And the biggest one, in my opinion, is that bladder and bowel awareness, mostly attributed to their low muscle tone. Because of that low tone, our kiddos may not feel that their bladder or their bowels are full until it's too late, maybe kind of running down the leg when they go, uh-oh, gotta go. And even a sense of feeling wetness on the skin can be inhibited. I remember when my daughter, who's now 21, going through some toilet training, and parents and grandparents all said, let's try the bare bottom technique and just let her sit in it until she gets uncomfortable. Well, she would sit in it all day long and not really have a sense of awareness on her skin that it was wet, or even it was drying on her skin. So that can impact that decreased sensitivity as well. So, and our children may have some delayed gross motor skills, getting them to the restroom, getting on the toilet, and then remaining on the toilet. And not just for an attention span, but many students, because of that stamina and endurance, core strength and upper body strength, if they're pushing themselves up to remain on, if they don't have the core strength to remain on the toilet comfortably until they go, it gets very taxing physically. Many of our students have some fine motor skills delays and coordination for undressing and dressing, and many old school thoughts of toilet training really encourage teaching toileting as an entire process. Uh, that I agree the whole process is necessary. However, I believe in let's start with one thing and we'll kind of backward chain until we get the whole array of skills involved. So I don't let the ability to undress or dress yourself kind of interfere with the ability to start working on toilet training. And then communication skills to let others know when you're wet, or when you have a bowel movement in your diaper, or when you feel like you have to go. Just the communication skills to let someone know that it's potty time. Potential history of GI issues, very prevalent with our kiddos. So sometimes as infants and toddlers, they've had constipation and they've associated having a bowel movement with something that's uncomfortable or painful. And so when it comes to toilet training, they don't look forward to that experience again. So that can definitely impact their receptiveness to going. And then I think another big thing is just resistance to new routines. Our members tend to like their routine and get into their schedule, and then adding something new is often encountered with some resistance on their part. And poor generalization to various toilets. So you may have different potties in your house, different heights, different colors. Each restroom's different. Going to the restroom at grandma's may be vastly different from using the restroom at home, at school, at daycare, at the church, at the Kroger, at the library. So all of these are kind of brand new opportunities for the toilet. So no one potty is the same. And then, of course, our members have some delays in their impulse control. So they might want to jump off the potty. Often, if they're engaged in a task, they don't want to leave that task to go to the potty. That's super common for all kids. And that can impact. And another huge issue that sometimes we overlook unless we have kids, my daughter has a dual diagnosis, are some sensory issues that impact their comfort in the restroom. A lot of these are environmental, and we don't think about all of these necessarily. So the lights, do we have LED lights? Do we have fluorescent lights? Fans that make a funny noise? There's often interesting smells in the bathroom, and I'm not talking about just what happens in the potty, but if you have a certain air freshener, or if you don't have an air freshener, or hairsprays or deodorants that might get used in that restroom that children are averse to. And even toilet seats, some children don't like the hard, some don't like the squishy, just how the potty might feel when they're on it. So all interesting things to think about. But before, we start talking about toilet training, I think it's really important to make sure that we don't have any issues that might be causing us to swim upstream, if you will. So all the literature really recommends addressing any potential medical issues that could impact toilet training before you think about starting. So if your child is still having chronic or even intermittent constipation, maybe getting that addressed and resolved before you start toilet training will help, so that once that process starts, it's smooth. You don't have to stop, you're not met with resistance, and then you're not setting up a situation that would eventually lead to a power struggle or some frustration. You can kind of start in a good place. And the biggest one, I think, is that chronic constipation, which impacts so many of our members. And when you think about constipation, you think, well, the poop's not coming out, or it's very large. And that's not always the truth. Sometimes, constipation can present as small pellets or hard, dry BMs. If your child is kind of producing things throughout the day that looks like little rabbit pellets, that is often indicative of constipation. Infrequent poops, of course, less than daily. Ideally, in a perfect world, we really should poop after every meal. So we're getting rid of, the toxins and the waste from our foods that come out in our poop after every meal. Most people don't, but at minimum, really a daily bowel movement is what I recommend. And if you've ever worked with me, especially in First Steps, every First Step session, I'm asking about their poop. How often, what's the consistency, sometimes what's the color, what's even the odor, to help families make sure that dietary needs are being met and we're keeping things moving. But another symptom of chronic constipation can be small amounts several times per day, which indicates your child's not fully evacuating every time they're going, if they're kind of going throughout the day, which can be problematic, if you're trying to track when they're having their best bowel movement to work on this, but it can be a pain to change lots of poopy diapers every day as well. And then loose watery BM. Sometimes families will confuse that for diarrhea, but it's actually some of the bowel movement working around the hard bowel movements that are in the bowel still, kind of coming around the poop and coming out. And then many children will complain or indicate they've got some stomach or even back pain when they're constipated. Having attended some of the national groups, their presentations on constipation, is so fascinating when they do some of the x-rays to see, you can see the bowels are impacted, and it really goes up through that whole core and trunk, and can look so painful. And this is actually something I asked families about when a child's having some maybe new behavior, especially some aggressive behavior. I always rule out potential medical health related issues, and constipation is one of them, because if you are impacted, you feel terrible and you don't feel like cooperating. So that's a good thing to rule out for behavior as well. So how do we address constipation? And I always tell families, consult with your healthcare provider or a trusted doctor, naturopath about this issue, but here's some things to consider. One of the frontline defenses that I love to use against constipation is a high quality probiotic. I'm a big fan of probiotics in general for multiple reasons. One is for mental health. One is for, enhanced immune systems, but also it definitely helps with your bowels operating better. So finding a children's high quality probiotic and getting some guidance from your healthcare provider might be a good place to start on that. Or you can, email or text me afterward and let me know if you need some guidance on that. Increasing fiber, of course, that's sort of a no-brainer. Yeah, just increase your fiber to help with constipation. However, I will say for our kids, it seems like they typically require just an inordinate amount of fiber. If you're just using that as an intervention, many times families, they just feel like they can't get enough fiber into their kids to fully address the issue. And I mean, fiber, many of you know I'm not a huge fan of gluten and carbs, so more vegetable fiber, fruit fiber, for example. And then increasing liquids, water, water, water. I'm a huge fan of water throughout the day. Just make sure your child's getting enough of it. If your child's resistant to water, doesn't like it, I talk to families about using flavored water. You can add different flavorings to your water, and sometimes they're not the sweet ones. It can be something like lemon juice, lime juice, even pickle and olive juice. Some children prefer those flavors in their water. Increasing physical activity, that's very important for helping with constipation. Sometimes our kiddos, if they have their motor skills are delayed, they're maybe not getting enough physical activity on the same time frame as they're typically developing peers. So ensuring that they're getting enough physical activity is important too. And families have often said, oh, once they started walking, our bowel movements kind of aligned, better, they improved. Once we're moving around quite a bit more. And then ensuring your child is chewing their food well. And this is typically problematic for our kiddos who have decreased jaw strength. They want to do a couple good chews and swallow, or they want to push the food up to the palate of the mouth and maybe gum it a couple times and swallow it, but we know that food needs to be broken down. Digestion starts in the mouth. So we want to make sure enough saliva is being produced so that when the food is swallowed, the body knows and has enough saliva to help break it down, and that releases some digestive enzymes that can help break the food down. This is sort of a cyclical phenomenon that happens with our kiddos. They often don't have enough or the right digestive enzymes to break down foods, which can lead to other types of digestive issues. And one of the things that we can do is just make sure that they are chewing that food well before they're swallowing. And if you have a very young child, you can work on this by building up jaw strength, doing some chewing activities and exercises, bite activated vibrating teethers, silicone chewers, baby safe feeders. Those can be really helpful in building jaw strength. And then another thing I'll throw out there is maybe if your child has been constipated shortly after they were on a dairy formula or that they started on cow's milk, is maybe reconsider dairy. You might try elimination from dairy for a while, trade out a fortified dairy alternative that's going to give your child enough omega-3s and enough calories, vitamin A and D, and calcium, but often constipation can be correlated for our kids with dairy-based products, and just swapping those out for some non-dairy alternatives can help with constipation. And then what I tell families too, at worst case scenario, that rectal stimulation, we just got to keep things moving. I think, I don't know about some of you, but I personally experienced, physicians who may have said, well, it's normal for constipation, just wait it out, or, they can go 5 days, 7 days, 10 days. Well, that might not be the best idea, because then bowels can be impacted and colons can stretch, and that can lead to other problems. So if you can keep things moving at least once a day, and if you need to do some rectal stimulation with a suppository or an approved rectal device to get that going, that's a good idea. And then there's some other potential medical issues. I won't go into great detail, but hopefully some of these have been identified and rectified in your child by the time they hit toilet training age. But diarrhea can be a common one, and it can be related to some celiac disease, which is more common for our children, that gluten sensitivity again. A probiotic can help with chronic diarrhea as well, getting that good bacteria back in the GI system. Dairy has a constipating effect for some children, but it can have a diuretic effect on others. So eliminating some dairy-based products, at least temporarily, to see if that helps. I believe, and the literature indicates, many of our members are, if they don't have full celiac disease, they are more sensitive to gluten. Again, sometimes they don't have the digestive enzyme to really break down that protein. So you could try reducing gluten to see if that helps firm up the bowel movements. And then maybe consider a digestive enzyme to see if that would help. You can talk to your healthcare provider about that. Many children have frequent urination, and my first suggestion is to rule out a urinary tract infection. Make sure that's not what's going on, because our children with that low muscle tone, and they have a different, sometimes a higher pain threshold, they might not indicate to you that they have a UTI, but that might be what's going on. And then ruling out overactive bladder. For some children, they will urinate frequently. Some of that is they don't get all of it out. The bladder muscles don't fully relax, and so they leave some urine in there, and they have this kind of chronic voiding all day long. But that can also co-occur with constipation, as large bowels and impacted bowels kind of push against the bladder. You can have frequent urination. And then some children experience the underactive bladder. So they're going less than 3 times per day. They're holding for a really long time, which could be indicative of some kidney issues. And that's a great thing to rule out before you try to take on the toilet training process. Let's rule out all the health issues. The anorectal malformation, hopefully that's been identified. That's just a malformation of the anus and the rectum, which happens far less often, but is typically identified at birth. Sometimes there's tissue overgrowth around the rectum, or the anus has a very small opening, and that can lead to some bowel obstruction. And then the undiagnosed Hirschsprung's disease. Typically, Hirschsprung's is identified before the baby's discharged from the hospital. However, I have worked with some families who just had chronic issues that went unidentified until the child was about 2 years old, and they found out, he had a mild case of Hirschsprung's disease. So ruling out all those potential medical issues is important before starting the toilet training. Okay, so we've ruled out all of that and we are ready to go. So what are the readiness skills we're looking for? Some literature for typically developing kids will set up this huge laundry list of skills. They have to tell you, they have to wash their hands, they have to dress and undress. And personally, I don't feel like we have to wait until all those skills are in place before we work on toilet training. For some of our children, those skills may not be in place until much, much later, and we don't want to delay toilet training just because our child has not mastered those skills. Those are important skills, and we still want to work on them. And if you have a child who maybe hasn't attained these readiness skills, you can still be working on those other skills while you're looking for these. But in my opinion, these are 3 very important ones. So having the child sit in one place for a short amount of time. We've got to sit on the potty to be able to use the potty, right? But we'll talk about some strategies to make that happen, to lengthen that a little bit later. Some children will show a curiosity and interest in watching others use the restroom. So if you see they really want to watch you go potty, or be in there while daddy's going potty, or interested in when siblings are in there, that's a good sign. And then for some children, staying dry for at least 2 hours a day during waking hours, that's important, kind of showing they're developing the bladder strength to hold it for a short amount of time. And eventually we're going to look at, if we're habit trained or conditionally trained, we're going to have these 2-hour intervals where we work on that skill. Okay, so a great place to start is we want some data. We want to know the times of day and what our child's doing, maybe what happens before and after, and where they are going potty. So we need to keep that information. So it can be 3 days, 5 days, 7 days. If your schedule's different every day, you might want more data. If you have a pretty good routine every day, you might be able to get enough information within about 3 days. But noticing when your child is urinating, checking that diaper, when they're having bowel movements, is it at a certain time of day after a routine? Maybe while you're getting the bathtub running, that's when their bladder's comfortable and they're going in their diaper. When we go outside, especially in the wintertime or when it's cool, that cold air hits us and they go. And then what type of potty is your child most comfortable in? Is it a ring? Is it the freestanding little potty chair? Is it one that has steps that can go up to the potty? And then what people are motivating for them, or what reinforcers are motivating. If you have a child who is crazy about Elmo, and that's going to be a great reinforcer, or your child loves bubbles, or your child loves music. So we're going to kind of start tracking some of the things that we can use as reinforcers once we start making this thing happen. I really liked this chart or tracking system that came from a book, and I'm going to show it to you at the end. It's Potty Time for Kids with Down Syndrome. And we are going to be ordering some of these for our library. But this, to me, was very simple. And you just track when they're dry, when there's urine, and when there's bowel movement. And you can circle, like, was that in a diaper? The pull-ups, did it happen in the toilet? And then you can create your own time slots on here, but what happened, and then any notes about it. So you can start tracking, we had a big glass of water right before that happened, or this is when lunchtime was. And then you can start putting some things together. There is a blank form at the back of this book, and there's a ton of different charts you can use. I would say use something that is going to be usable for you. So if you have this huge chart and you're feeling overwhelmed just looking at it blank, that might not be the chart for you. Find something that's, and if a chart is too stressful and you just want to make notations on a piece of paper, that's great too. Smartphones are great now with the note apps. That's a great way to keep data because you can be anywhere. Most of us have our phones, unfortunately, with us everywhere. And that way you don't have to go look for the piece of paper or log sheet. Okay, so now once we've gotten some data and we can kind of see when our child's going, it's happening, we're wet as soon as we wake up, we go 30 minutes after lunch, we always have a bowel movement, between dinner and bedtime, and you're getting an idea, they always go behind the couch to have a bowel movement. Or they always, squat behind the, well, I had a child once I worked with, he would always go under the family's baby grand piano. So you're looking for patterns of where your child's going and when and how they're comfortable going. So the first thing I love to do is just embed into your natural routines. Sometimes we get tied up with time. So we've got to go at 9 o'clock and then at 10:10 and 11:20 and 12:40. And that can be very stressful for families. So our children often don't tell time at the time that they're working on pottying. They're not necessarily going to know, but they know their routines. So embed toilet training in your natural routine. Before nap, after you wake up, before snack, before bath time. And I love starting with just one routine. I'm kind of a slow goer at this toilet training. Instead of saying, okay, Monday's the day we're going to toilet train and we're doing it 27 times in one day, going back to our children's resistance for new routines, that can be very overwhelming. And then when they fight the new routine for a few days, you're exhausted, they're exhausted, and now we're 3 steps backwards in the toilet training process. So I love just starting with one comfortable, natural routine. For example, for many families, if they do a nightly bath, this can be in the bathroom. You're watching the water fill the bathtub. You have the sound of the water. It's something they're looking forward to happening. It's kind of cozy. Shut the door. It's getting a little warm in the bathroom so they're comfortable. You might be in the same bathroom every time you take a bath. That might be a good time. If you don't do that every night, but you have another natural routine around the time that they're going, whether it's just urine or bowel movement, use that routine. It doesn't have to be exactly this one, but just start with one time and embed the one time. Have some success with that one routine. Great. They're potting every night before bath. Okay, now after we've done that for a couple of weeks, now we're going to add a second routine. So now we're going to potty before bath and we're going to potty right after we wake up from nap. And then you just kind of layer in these other times. I would initially focus on remaining seated. So even if your child's you're not sitting him on the potty with the diaper off, okay, we're just going to work on sitting. It's great if you can sit with diaper off. Some children aren't there yet. We're going to talk about that in a minute. But let's just focus on sitting. We can't make a child use the restroom, and the more we try to make them, often the more resistant they become, and now we're in a power struggle. So the first goal is just going to be sitting on the potty. I don't care if you sit there for one verse of Itsy Bitsy Spider, or I don't care if you sit there for 30 seconds. We're just going to have a positive sitting on the potty experience. You're getting lots of yays. You're such a big girl. You sat on the potty. And then slowly adding a few seconds each time. A visual timer can be great. The first picture is an app that I use all the time that slowly uncovers a picture. So that can be a fun one, and you can set it for whatever time intervals I believe you want. And then the middle one is more of a standard visual timer, and you could use a sand timer as well, but just start slow. I think historically, some misinformation that has been out there is have your child sit until they go, whether it takes 30 minutes, 45 minutes, an hour, and that can just be frustrating for everyone and lead to some not good stuff eventually negative connotations about the potty. Another big issue is making sure your child feels comfortable and safe on the potty. So whatever device you're using, whether it's freestanding or ring, I love the third option here, so they can eventually, climb up, turn around, sit down, and have handrails there to help with. And also to have some foot support. So what we know about the bowels, if your knees are above your hips, that helps the poop come out a little more effectively. You're just physically in a better position to ease the poop out. So when we think about putting kids on the potty, typically our kids are much shorter, feet are dangling, their circulation's getting cut off on their legs, they're trying to hold themselves up with their arms, or we're trying to sit in front of them, holding them on the potty, getting sweaty and red-faced, and everybody is uncomfortable. So if you want your child to sit there for an extended period of time until something happens, we have to make sure that they feel safe and confident and comfortable on the toilet. And then waiting for that accidental go. Toilet training typically happens because the child, they urinate, they have a bowel movement in the potty, and then we give them that reinforcement. Yay, you went. And they know exactly what it feels like. And that's usually the first accidental go that we can reinforce and start this wonderful ball rolling. But how do we get that accidental go? Sometimes it's waiting out. Sometimes it's giving them a drink, putting their hands in warm water. You can even have them play in some warm water with some toys sitting in front of the potty. I would recommend for children who like to play with toys on the potty that maybe having a table or a tray so that the toys don't fall down into the potty. That's never a fun thing for parents. You can run some water in the faucet, in the sink, in the bathtub, trying to just set the tone, but making it kind of a relaxing experience. You can, dim the lights if possible, put on some soft music. And then for some of you who want to model this skill, if your child's sitting on the child-sized potty, and you feel comfortable modeling going while they're in there, that's a great way. We know our children are typically better at modeling that social behavior, so that's a great one. The next step, once we get the accidental go, is to reinforce or reward, and this is hugely child specific. So no one thing ever works for every child, and I think if we had this magic wand, it would be great. But while many of our children, what I've experienced is they either like the tangible reward, you give them something, or they like the social praise. Sometimes our children who have that dual diagnosis of autism, maybe the social praise can actually be aversive. They don't want the big yays and the claps. That's going to cause them to have a meltdown. So, but they might want a high five, or they might want some sensory rewards, or they might want a tangible. But some children love being rewarded with activities. Yay, you went potty, we're going to do bubbles, we're going to have a special game, read a book, do a dance party, sing a special song, have iPad time. If they like certain characters, you can reward with a tiny figurine each time they go. Sometimes with children, you can recycle these so they forget about some, so you put them away, bring them back out a few weeks later, and you get to reward them twice with the same prize. And some children like the sticker chart. I have worked with a few who that was enough for them, but most, in my experience, have not. Okay, so some preventative techniques for the potty is if it's potty time and our focus is sitting, then it's potty time. I never ask in this process because our children don't always have the sense that they have to go, or they're always going to tell you no because they don't want to leave the fun thing that they're doing. I just say it's potty time. That's what time it is. You can set a timer. You can have an alarm, just set your microwave and have it go off, and that means it's potty time. Let's go. It's very matter of fact. Using first thens if you have some resistance. First we go potty and then we play. First we go potty and then we're going to eat a snack. You could even use a visual cue card if you feel like they need a visual representation of potty and what's going to happen next. Have a special potty time toys or activities that are only in the bathroom. So they only get to read certain books or play with certain toys that are in the bathroom. So that way they become special. If I have one of my favorite toys in the potty and the only time I get to play with that is when I'm sitting on the potty, I'm going to be a little more eager to be in there. And then many child get bored of the same reinforcer all the time. So this is for anything, not just for toilet training. I found with our kiddos is mixing it up. Use something that works for a while. If it doesn't seem effective, switch it up or give them a choice. So do you want this or this? When the pee comes out, do you want this or this? And that helps them feel a little more invested in the process. Like we said, make sure the bathroom is sensory friendly. Nobody wants to strip down naked if the bathroom's freezing. Adjusting the lighting or the noise or the acoustics. Bathroom can be very echoey and hollowy sounding. So having additional rugs in there or a thicker curtain, even throwing some towels over the towel racks to kind of soften the noise in the bathroom can be great. And then reading children's books about the potty. You can read them while you're on the potty. You can read them before and after. You can read them before you even start this process, so they're a little bit more familiar with the routine. Some of my favorite potty books, these are some of the classics. I think some of these have been around. My oldest is 21 and my youngest is 8, and we've used some of these for all of them. But there is a social story here I referenced. This is a nice one. It does cost, I want to say it was maybe $12, but that could be well worth it if you just want a quick social story, and you can get it for boys or girls. Maybe you can go in with a family and share the cost, and you can trade resources. Or if one of you has a boy and one has a girl, you can get it and share them. And I would say when it comes to toilet training, because that sense of, oh, my bladder and bowels are full, I need to get to the restroom, that sense of toilet training can sometimes come much later. So I tell families really focus on conditional or habit training. And this just means getting to the potty, knowing what to do when they're on the toilet. For many of our children, that's where they will be for months, potentially years, until they really can identify those body cues and know the need to get to the toilet. Some of our children, if they have co-occurring issues, that may be longer, but most children can be conditionally trained where they know exactly what to do when they get on the potty. The trick of this is making sure every adult in that child's world throughout the day and night can adhere to the child's toileting schedule. Otherwise, you're setting up potential accidents. So once you decide on what that schedule is going to be based on the data you've collected, and then the child's natural schedule, whether it be daycare or school or home schedule, that's going to dictate to some degree what your schedule looks like, with the ideal of going at least every 2 hours. Wearing underwear under the diaper, it can help feel a sense of wetness. Unfortunately, diapers and pull-ups have done such an amazing job of helping our kids feel dry. It doesn't really help them feel wet when you're trying to increase what that means. And using timers or potty watches are great to remind adults. We even have some young elementary students who wear a potty watch, and when it goes off, they're great at getting themselves to the potty. I know in some schools, I've worked with some children, maybe middle elementary, where the teacher just has to put a picture of the potty on the child's desk. She'll be busy doing a lecture, walking up and down the aisles. She just puts a picture of the potty on the child's desk. The child gets up and knows exactly what to do. So she doesn't have to kind of call that child out to her peers. She doesn't have to stop her lecture. The classroom just continues to flow very naturally, and that's all the cueing that child needs. And also at this stage, it's super helpful to have easy access to whatever toileting system you're going to have. So if your child likes the rings, have a ring in every bathroom. If your child likes the child potty, have one on every floor of the home. whatever makes it quick and easy, because you definitely don't want to be running to the third floor to grab the ring when the alarm goes off. That might be too late by the time you get back to the basement. And then, of course, we all encounter difficulties. I tell parents all the time, just be prepared for this. Consider that the norm. And then if you don't have it, fantastic. But it's rare that everybody has a smooth sailing potty training experience. So there's often, periods of regression. That's true for all children. So yeah, a lot of families will make great progress toward toilet training, and then the child gets sick and you have to kind of regroup, or a new baby's brought in the house and there's some regression, or there's a stressor in the environment, their schedule changes and there's some regression. That's totally normal. But what we know from some of the literature, and this has been my experience as well, getting back on track comes easier than the first time. So don't get too disheartened that it probably won't be like going back to ground zero. It'll be a little bit easier. At this stage, you can use some social stories or personalized stories of the potty process. I love personalized stories, taking pictures of your child walking to the potty, on the potty, washing their hands, and then print those out can be wonderful, and you can read those. For some children, they might be more anxious or agitated in the potty. So using those concentrated relaxation techniques, helping them with deep breathing, smell a flower, blow a candle, helping them with that, soft music, just really, because no good's going to come in the potty process if the child is starting out anxious. So I think you've got to get them back to being comfortable. We don't recommend punishing accidents, but you have your child help with the cleanup, because oftentimes our children, accidents truly are accidents. They're maybe out of their volitional control, out of their awareness, and then they have this negative connotation with, uh-oh, I peed, and now that's something, mommy and daddy were mad. And so we don't want to associate those two. But having them help clean up is totally reasonable. Just doing it in kind of a non-punitive way. Many children love the diaper. It makes them feel secure. It's soft. It's warm. They don't want that diaper off. And so allowing your child to wear the diaper while they sit on the potty and go, sometimes that's a first step. And then we slowly, take the diaper off. In the potty training book I'm going to reference, I love how they handled it. They actually cut a hole in the bottom of the diaper and made the hole bigger and bigger and bigger until they had a band of diaper around the waist. And that's definitely a systematic way of getting from A to B. The other strategy I loved that they mentioned is having the diaper underneath the toilet lid or the seat and the bowl. And so the child felt like the diaper was close, but not on their skin. So again, just being very child specific on what would help your child, and start where they're at and kind of moving them in the right direction. And then some children, they only want to potty in the chair in the family room. And then what you do is you just slowly move that potty chair closer and closer and closer to the bathroom. And if you are experiencing some chronic accidents, sometimes it's good to step back and evaluate if there's a potential underlying payoff. You've ruled out the medical health stuff, but I've seen this in schools and daycares where sometimes our children will have accidents because they know there's something reinforcing about it. I either get all this great attention, I get to get out of something I didn't want to do. People are super sweet to me. I get a new change of clothes that I wanted to wear anyway. So there can be some potential payoffs, and sometimes just taking a step back, or if necessary, have your behavioral support specialist or an outside observer to come in and kind of watch when it's happening and see if they can have some clues to what's going on. And then here's where that generalization comes in. So public bathrooms, you might feel like you're starting over. So let's say you've had some great success at home with toilet training, and now you want to take the skill on the road. So scoping out the most common bathrooms you may use is a really good idea. If you are a regular at the library, at church, at Kroger, you always use the same bathrooms. That's a great great to go in and just scope it out. Say, okay, is it big enough for me to get in this potty? Is it big enough for me to squat down and hold my child on the toilet? Do they only have gender specific bathrooms and I'm a parent of the opposite gender? So what's the plan for this? Where are the places with the family style bathrooms? So you can even talk to the manager if you're, you know, at a Kroger and say, hey, do I have permission to go in? Sometimes they've been really kind. I know with my husband, our daughter has Down syndrome. And so when he was her primary caretaker when I was working a lot, and he would have to take her into in the men's room, and he would just, you know, talk to the manager and make sure no men were in there and then take her in. And then, unfortunately, and all the advances of the automatic bathrooms haven't always helped our children with some sensory issues. So some of those air blowers that really like could blow your skin off your hands, those can be a little intimidating for little ones. So if your child is afraid of the automatic hand dryers, maybe bring some paper towels. The automatic flushers, those can be terrifying too, even for some of us adults. So I love this idea of putting a Post-it over the automatic sensors so they won't go off until you're ready, till your child's off the potty, pants pulled up, maybe even they've stepped out of the stall. And then having a, you know, if your child needs a ring, do you have a portable ring? Is there, I love those fold up rings that you can take on the road. Those are nice. And then nighttime toileting, and this can come sometimes years later. The average toilet training for our children can be anywhere from 3 to 5 years. I think the last statistic I read was maybe 4 years, 6 months. But for true nighttime training can be much later, anywhere from, not to dishearten anyone, but 7 to 11 years. I think one statistic I read was 60% were nighttime trained, and then 98% were nighttime trained, like even a little bit older. So it can happen much, much later. But some tips, you know, wait until your child is successful during the day. Try not to do this at the same time. And be prepared to maybe use some other strategies at nighttime for a little bit. Obviously, stopping liquids 2 to 3 hours before bedtime. I like the idea of having 2 layers of sheets with the mattress pad in between. So if you do have an accident that soaks through, you're not changing sheets in the middle of the night. You can just strip off one set of sheets in the mattress pad and you have another sheet underneath. And then if your child wakes up throughout the night, which can be indicative of some sleep apnea, which isn't good, you want to address, but if your child does wake up in the night, take advantage of those times and have them use the restroom as a natural awake time. Or if your child goes to bed early, 8, you don't go to bed till 11, maybe waking them and have them go potty if they can fall back to sleep pretty quickly. Worst case scenario, and they usually don't recommend these strategies until children are a little bit older and they've rolled out all of the other behavioral strategies, is using bed alarms, excuse me, that ring when your sheets are wet. And there are some medications that your physician can prescribe, especially for short-term use, or if you're going to be on a vacation, you're staying at hotels, and you want to make sure that that might not be an issue, or you're having sleepovers. Your child's going to have sleepovers, and you don't want that potential outcome during the sleepover. That might be something to consider. Okay, so some of the resources, there's a great potty book that I'm going to show you when I turn my camera on. Ready, Set, Potty, Toilet Training for Children with Autism and Other Developmental Disorders. I believe that might be a second edition. The first edition, I think, came out years ago, and I've used strategies from that publication for many, many years. And then there's a nice resource here from our national organization that even has some sample data collection charts. And some social stories, which is great. Or I'm sorry, not social stories, but like a visual schedule of all the steps that go into toilet training. Some of them, again, I'm one to like, let's focus on the toilet training and then we'll add in the layers that go with it. So the pulling down of the pants, pulling up, washing hands, but kind of starting with one and then adding all of those other routines into it. Okay, well, I'm going to turn my camera on, maybe.
You're on. Oh, I think you're there. Hi. I'm going to go ahead and turn off the recording and then let anyone ask questions. That looks like we have